So I've got this patient, right? And she has the audacity to have a painful low back. Audacity is probably the wrong word. In fact, we wouldn't really have a job without any of this stuff. So let's be reasonable here. In any case, that pain is happening right in the L5-S1 area. Very original. In any case, the sacrum itself was found to be posterior, counternutated, which I promise you is a real word, but it just means backwards, posterior, something to that effect. Now, it wasn't that the bottom end was held anterior, but something was pushing down. So for something to push down, it has to be closely attached. And what that was the lumbar spine. It was, at the time, relatively flat. And the lumbar spine is supposed to have a nice general extension curve. It's supposed to have this, but it didn't have this. It has that. And so if that's the case, something also has to be pushing on it. Now, the next highest culprit above us is, of course, the thoracic spine, which is more than big enough to cause this problem. But it can't be acting alone because the thoracic spine is a skeletal structure. It has no muscular ability. So I have to pull this thoracic spine down and around. I have to pull it both forward and I have to pull it around to get that. So I need some kind of muscular contraction. But there's nothing below it to do that. So I need something else as a pivot point for that. I need some kind of an anchorage, or what you might call a fixed point in mechanical terms. Now, we have the pelvis here, and the pelvis has multiple points of attachment shared between the thorax and the pubic symphysis, one of which is the external oblique, another of which is our rectus abdominis. These are more than large enough to create a pull on the correct angle, both downward and forward. And so when those muscles are short, and they were, pull that thorax down and forward, they also pull up and technically superior on the pelvis. This straightens and elongates the low back, particularly the lumbar spine, because that L5 is the most mobile point here, and because, again, that sacrum is relatively posterior. The maximal point of strain for the low back becomes between L5 and S1. And so the ligaments in between this area are on quite a bit of stretch, which means they are more likely to hurt. This makes a nice circular dysfunction, a nice circle of anatomy that pulls and pulls upon itself, and in fact sustains itself. It can be tricky to get rid of, but you can certainly do it. Now, the reality is, this is almost always part of a greater problem. And so when we add in some of the rest of the anatomy, you'll find it's part of a much larger set of circles.